Hi and welcome. It's Lucy here from Inclusive Change and Inclusive Change at Work, our community interest company. We're talking about the Castle Conference. We're talking about digital well-being for young people. And today I've got with me Louisa Fassi, who is a PhD researcher from the University of Cambridge. Louisa, tell us about yourself and your role.
Okay. Hi, Lucy. Nice to see
Hi.
you. I'm Luisa. So, I'm a researcher at the University of Cambridge where I work across two departments. One is the Department of Psychiatry, and the other one is the MRC Cognition and Brain Sciences Unit, which is a long name that refers to a research unit that deals with anything about the brain, mental health, and cognition. And specifically, I'm passionate about understanding how social media use and technologies relate to the mental health of young people. So, this is what my research is about. I try to see whether there's a link between using social media in certain ways and mental health, both in positive as well as negative ways, with a specific focus on young people that have mental health conditions, so that might already suffer from mental health symptoms.
Wow, that's a lot. That and could it be more relevant for our conference? I really don't think it could be any more relevant. Fascinating. So, you're going to be speaking at the conference in April 2024, so the 25th of April. Hopefully, you're watching this before the conference because you get a chance to come along. Those people who are watching and listening now. What are you going to be talking about there, and why is that so important?
Yes. So the core of what I'm going to discuss is really about the relationship between social media use and mental health. There's been a lot of public debate about whether social media is contributing to this increase in mental health symptoms that we're observing. And this debate really started from these two trends that we are seeing. One trend is this increase in social media use in recent years, as we all can observe. Young people are so much more on their phones than they were before. Social media are really a thing. It's very common to spend a lot of time online. So, on parallel to this trend, we've also seen a trend of increase in mental health symptoms, such as
Mhm.
anxiety and depression in recent years, as well as suicide rates, which make us think that, yeah, this is worrying, and we
Is
need to
there a link?
understand whether, yeah, is there a link? And whether social media might be a factor contributing to this increase, or if it actually there might be other reasons. And so what I do is really understanding this relationship, which, as you can imagine, is quite complex because
Well,
on different fronts. Yeah, so I'm happy to discuss it more in detail, but really I'm about understanding whether this link is there, and most importantly, for who. So for which young people, in which direction, and for what type of social media. So it's a big question, but there's a lot of sub questions into it that I'm
and
gonna tackle.
there's a lot of facets, aren't there? And a lot of it's not a one size all fits answer, is it?
It isn't. And that's what research is already showing. There's a lot of what we call individual differences. So there are certain characteristics for which that explain differences in the relationship between social media and mental health. One might be gender, one might be age, and another one might be, for example, being affected by a mental health condition already. So, depending on all of those, the relationship between social media and mental health might differ. So, it's really not. And yeah, there's also an aspect about the type of social media use that we are considering, because there's definitely not one social media. So when we talk about it, we need to also think about what exactly is it referring to.
So I talk about neurodiversity a lot, and that kind of covers a whole spectrum and range of different conditions. But we're talking about things. I talk about things like autism, ADHD, dyslexia, dyspraxia, Tourette's, OCD, and there are I'm just gonna say I think there are some facets and some elements of neurodivergent young people that are probably more at risk and more vulnerable to use of social media and being online. Is that something that your research is exploring?
Yes, that's definitely something that I'm looking into. So my general focus is really on young people with mental health conditions, which also includes ADHD and autism, as well as internalizing conditions, so anxiety and depression. And
Yeah.
what we know so far is really that there's very little research on clinical groups, and that also there's very little directional research that tells us how social media affects mental health rather than vice versa. So far, I think there's very little research to say whether there's a relationship there and for what type of mental health, right? Does it have to do with inattention symptoms or with other
Mhm.
specific symptoms related to neurodivergency or relating to internalizing? So yeah, there's not a lot of answers yet. And I think that's why it's so important that we start doing research on this topic.
And is that because the not a lot of answers yet? Is that possibly because this is new? There hasn't been the length of time to be able to do those studies and pick that stuff out.
Correct. Yes, there's a lot of reason for the answers not being there. One of them is that indeed, like social media is pretty new, and the fact that it started around like 2012, and we've had a few years now. But usually, what you want is like these big longitudinal studies that track a young person over time and see how their mental health is changing, and those are very hard to set up. So I think more and more now we are seeing this type of longitudinal design in research. Another reasons is that it's very hard to recruit clinical groups compared to
Mm,
like school sample or people from the
yeah.
general population, right? This is a specific type of population that is more at risk and that, yeah, is just harder to recruit in terms of research. So it's also harder to get ethics to perform research in clinical settings. So we are seeing less research also because of that.
So you've got that challenge around that. So if you were looking at stuff, so just to break it down, because I'll think of it in
Yeah.
layperson's terms, because I'm not as academic, but just to say, if you were looking to do this study with, I'll say, mainstream young people, so people who are in mainstream school, who maybe haven't got those experiences that you're talking about, or haven't identified or being diagnosed with those different conditions, it would be a lot easier to do this because you'd have greater access to a greater amount of the population.
Yeah, so there are more of these people in general terms, and also it's easier to access them because of safeguarding concerns
Mm-hmm.
that are a big part of like receiving an ethical approval from a university
Yeah.
to run a study. So all put together, it's just really hard to run research like with clinical populations, especially if they're underage, which is another factor.
Yeah,
Yes.
definitely. It's not easy, is it? It really isn't easy. I can
No.
hear from what you're saying. But I also can hear and see that you're truly very passionate about this work.
Yeah, no, definitely. I think it's very fascinating and it's a very big question that we need to tackle. We need to
Mm.
understand whether there's a link between digital technologies and mental health and for who is there. And this is going to be key if we want to develop interventions and tools that are going to help to make online spaces safer and better for young people, which I think it's the end goal. We are not seeing technologies going away. Like social media are there to stay. They're probably going to evolve in different shapes or form. So we need to really have an evidence base to say where are the risks, how do we target them, where are the benefits, and how do we harness them. And yeah, it's very important to create an evidence base to then get into like interventions,
Wow.
policy, etc. Yeah.
I just feel quite grateful that there are people like yourself and your team and your researchers who are doing this work.
Yes, I'm glad to hear.
So are you part of a wider team that is looking at this? I've heard of the Millennium Cohort Study because there were reports out earlier in January about social media use and how teens were, you know, what headlines come out with it in newspapers, and they're like, oh, 50% of teens are addicted to
Mm.
social media. Is that what you're involved in?
Oh, I know a lot of those headlines. Every time I read them, I'm like, yeah, on the cautious side for making these statements. Yes, so I'm part of a bigger research team based at Cambridge. both across like these two departments, psychiatry and cognition and brain sciences unit. So with a lot of other PhD postdocs and Dr. Amy Urban, who is my primary supervisor. And all together, we are trying to tackle these big questions from different angles. My angle is about clinical populations, and then there's people involved more on the general population and different aspects of social media use. And to tackle this question, I use different methods. One of those is looking at these big data sets like the MCS or data sets from like the NHS, ALSPAC, so where you have these measures of mental health over time and of social media, and you try to relate those. Another angle I use is qualitative research. So I actually interview young people and really put them at the heart of the research process. So let them tell me what I should do in terms of next steps and what they feel are the benefits and risks of like using social media in relation to their mental health. So those are like the two main angles, the qualitative and the quantitative one, and I try to combine them.
Can I ask you, what's coming out of that research? So for instance, what are the young people telling you?
Yes, lots of things. So the qualitative project now is focusing mostly on identity development, which is one specific aspect of using social media. So what we're asking them is, when you're becoming an adult, one of the main things that you're grappling with is your identity. So answering questions like, who am I and where do I belong? And now that we have access to digital devices, these questions become very salient because you have a lot of comparison to other people, but also you have a lot of materials to explore who you are. And what they're telling us is that it's a double-edged sword in a way, which we see also in other domains. So they feel like through online spaces, they can explore more than identity. So they have access to, a lot of things that they might be interested in, a lot of values. So they go online and explore, which makes them feel good in terms of having the freedom to see what is out there. But also sometimes it impacts them and their mental health in a way that they feel a bit lost because it's hard to then define themselves. And they see a lot of very high standards online, which they might feel there are to match. And this creates a sense of comparison, which might lead them to feel anxious. So in terms of identity, we are seeing both sides. And we are currently interviewing people. And this also differs depending on their age. Underage people, so 16 to 18-year-olds, tends to say that, they feel a bit more lost. Whereas when they're older, they actually say online spaces help them a lot to figure out like who they are and their interests and explore their identity.
I get that anecdotally from people I work with and people I talk to, and older people do quite often say that the online spaces are really, they're a place for them to find their friends. They find their tribe. There's a word I was using earlier today with another group. They find their tribe. They feel comfortable in those spaces. But as an adult, sometimes, or as a parent and as professionals, we sometimes see those spaces as quite dangerous for children who are too young and haven't got yet that developmental part of their brain ready to see and access all that information.
Yeah, that's the thing. At the moment, social media is allowed to, like, you're allowed to create an account from 13 years old onwards. So that's the legal age, which is also an important thing to highlight because sometimes children start having social media accounts earlier, which is actually
Much younger.
not.
Yeah.
Yeah, exactly. Even at 13, there's a lot going on when it comes to social media. And so it's really important to think how to create these safety nets where we can protect young people at earlier ages that are, just connecting with a lot of peers, seeing a lot of information, being exposed to just a lot of things, and might not have that development, both psychologically, socially, on different aspects to just face this.
Yeah. It's really thought-provoking. And we're not gonna talk about all of it here today because we would love people to come to our conference and actually hear more about it. No spoilers. So our conference, just in case you haven't remembered, is on the 25th of April. You can find out more at icaw-cic.com. I've got another question for you then, Louisa, which is, what are you hearing from other professionals in academics on this topic? Is it really all as bad as people think and the headlines make it out to be?
Hmm. So I'll start with academics because that's easier for me since I hear from them
Yeah,
every
that's where
day,
you are.
all
Yeah.
day. Yes. And what I hear is that definitely there's not clear-cut answers. So we
Hmm.
don't have the evidence to back up these big statements about social media being bad. Evidence is showing that there are small effects in both directions. So social media affects mental health in terms of leading to a small increase in anxiety and depression and mental health symptoms. This increase
Hmm.
is not clinically relevant in the sense that it doesn't put you from a non-clinical to a clinical level of anxiety. This is what we're seeing.
Okay.
So it's a small association and it goes in both directions. So social media affects mental health, but mental health affects social media as well. So if you're feeling anxious or depressed, you might go and spend more time on social media. And the other facet is that I'm talking about social media as if it's one thing, but research
Mm.
what is starting to show is that there's so many ways of examining what social media is. Is it the content that you're exposed to, the time you spend, what you're actually doing, the messaging? So
The people.
there seem to be differences based on what we are actually measuring in terms of social media use, with some activities showing more negative effects, such as comparing yourself to others, being
Mhm.
exposed to content such as like bodies and thinness ideals, particularly for girls, compared to other types of usage like connecting with friends, communication, self-disclosure, which actually is related to better
Positive.
outcomes.
Yeah.
So yeah,
Yeah.
there's a lot of nuances there. So this is what I hear from the academics. From the other professionals, I have a bit less contact. I have contacts with clinicians though, and what
Yeah.
they tell me is that it's really important to do research on this because oftentimes social media and technology is brought up in clinical settings by young people, and there's very little understanding on how to support them. So
Oh,
it
wow.
might be one of the reasons contributing either positively or negatively to their mental health journey. So it's really important to give clinicians tools to be able to integrate this technological and social media aspect in the clinical setting.
That's I think that's really impactful, and yeah, I work with a whole range of different people, and only today I was with the integrated care board project team, and that kind of information about being able to give tools to clinicians to support young people, that's actually part of the strategy of what they need, isn't it? And your evidence base is going to hopefully bring it to a point that actually we'll get funding, we get the support to be able to do that kind of stuff.
That's the goal.
Fingers
Yes.
crossed. Thank you. And I'm gonna bring just pick up something that we kind of mentioned a bit earlier. Headlines in newspapers. They don't always tell the truth, do they? Or they don't always they spin it how they want to sometimes.
Yeah, especially when it comes to causality. As I mentioned, a lot of studies are about association. So you see that something is related to something else. For example, spending more time online is associated with increased depression. This doesn't mean that spending more time online leads to depression. As I mentioned, it could also be the other way around, that you're feeling more depressed, therefore you spend more time online. Or it could be a third factor affecting both of these things. Young people spend a lot of time indoor, they might have more sedentary behavior, which then
Which can
leads
lead
them
to
to spend more time online and being depressed. So it's this third factor, right? And yeah, and most of the studies have this correlation, so association type
Mhm.
of design, but most of the headlines are about social media leading to depression, which doesn't really reflect the type of research that is out there.
Oh, that's incredible to be able to not debunk it, but to say, actually, this is a headline, but here's the evidence. Here's what's actually happening. And there's a whole lot of other causes of depression and anxiety in young people. The climate crisis, the cost of living, money, jobs. All of this is impacting, and it's not just social media that's making that happen.
Yeah, that's a very relevant point, and I'm now It's one of the questions that I'm trying to tackle now, but also in the next steps, like putting things into perspective. I think if we want to say something about social media, we need to also compare it to what are some of the other emerging causes of the potential
Yeah.
mental health declines. And when you have them all together, see how each of those relate with the appropriate like design in terms of research to take away all the other causes. So yeah.
Oh my goodness. So my next question is, what can we do? What do you think we can do to make this make a change and support young people in a time where we are being told that there is a mental health crisis?
Mhm. There's a lot to be done, and I think it depends who the question is targeted to. So as researchers, we definitely
You're a
have a lot.
perfect researcher, Louisa.
Yeah. So we can do a lot in terms of improving the research, but I think I've already talked a lot about it. So taking other perspectives, which I'm less good at, but I'll try. I think as parents or people in the community, literacy is very important. So
Okay.
understanding what online spaces look like for young people, what are the trends that are going on, talking with young people, the same way I talk with young people in my research to figure out through them what's really important. People can do it, right? Parents can do it, friends can do it. If somebody's going through a hard time, like trying to understand what exactly is going on. And when it comes to digital technologies, how does the digital space for them look like? What kind of things are they doing in there? Social media and digital spaces are very individualized experiences. Each of us is going through something different. So it's important to talk through it and understand how that experience looks like to be able to provide support. And this can be also for clinicians. I think it's one of the things that can be important and can be,
That's
I think, part of the change. Another thing, I'll let you wait. I didn't want to
no, go
go on,
on.
sorry.
No, please do. Tell me the next one.
The next one is about companies and finding a way of getting better data so we can study this very complex question. Data about social media, right? Objective data that we can use to see what people are doing online, because so far we're relying a lot on self-reports, so just people telling us what they do. But it's very important to get data about what exactly they do online, and this requires collaboration with companies like Meta
Mm.
that
And
would
well,
make
that
this
takes us
happen.
then into, yeah, but that does take us then into a whole ethical privacy data, what who's watching and who's collating that information. A big difficult challenge. I'm not going to say that's an easy one, that one.
Let's not talk through it because it's gonna
Yeah,
take us
no.
an hour. Yes.
No, no. But I liked what you said earlier around what can we do as parents, as professionals, as carers, the digital literacy. So actually finding out what your young people are doing, going on to those spaces. I did that once. I went on Discord. I sound like an old lady. So I joined Discord. Within literally 5 seconds, my son came running downstairs. Why are you on Discord? Because it popped up that my number popped up. It popped up in his world, and his friend had told him his mum had just joined Discord. And so, but you can do these things. And so I found out then, oh crikey, this is so immediate. This platform is one that's boom, it's there. But you can go and do that kind of stuff.
Yeah, exactly. And then this is gonna help have conversations, right, with young people, being like knowing the trend, knowing what's going on. It's very hard to stay up to date about all the trends, but even
There's
just
new ones
knowing
all the
like
time.
how the platform looks like the fact that you watch reels on TikTok, like all of these things,
Yeah.
right? It makes like the conversation and having the language to speak about this stuff is already like a very big step, and it makes them
Yeah.
open up as well because they feel like they can have a conversation because there's a baseline understanding from both sides.
I have one last question for you. What's the next steps in your research? Because I am literally so intrigued and so interested in the stuff that you're talking about. What's the next steps?
Yeah, so there's multiple but the focus is really going to be understanding how social media use is used by young people with mental health diagnosis and or
Okay.
mental health conditions. Do they use social media differently? That's going to be our first question, which I've partially addressed in my research, but really like getting a better understanding of it. And then secondly, trying to get to the causality link, right? So is there a link between using social media in a certain way and then potentially developing worse mental health outcome as well as better mental health outcomes, and how we can differentiate these different types of usage in relation to mental health so that then we can, harness the good ones and protect against the bad
Yeah.
ones.
I think that will be a difficult part of your research, like you say, access to those clinical groups, access to people who identify in different ways. Because, for instance, will you be looking for people who have a diagnosis, or will you be considering and talking to people who self-diagnose or self-identify as neurodivergent?
Mm-hmm. Yeah, that's a tricky part. At the moment, I'm using the quantitative aspect is using data from people that have been diagnosed from the medical system,
Yeah,
but that's just very hard to have
yeah,
this kind of data. So oftentimes what you do in research is instead of asking them if they have a diagnosis, is run like a mental health screening that is an approximation of
yes,
how their mental health is, and then using that as a proxy for saying
yeah.
like this person might be more at risk for this type of condition.
Amazing. Is there anything that you wanted to add or that you wanted to share before we finish up?
No, I'm just very excited for the conference, and I'm
Me
gonna
too.
present some of my newest findings, which are unpublished. So I'm really excited to, yeah, get input also from the people that are gonna be there and hear from them what are their thoughts and questions. I always find it very reaching.
Oh, it's just incredible. So, just to remind you, our conference is the Castle Conference, all around digital wellbeing for young people. It's on the 25th of April in Lee Court in Bristol, but you can find out all about it through Digital Safety. So, DS. Let me start that again. You can find out all about it from Digital Safety's website, which is ds-cic.com, or you can take a look at Inclusive Change, or our specific website is icaw-cic.com/events. You will find out all about the conference there. But anywhere you're watching and listening to this, I will to you for another hour about everything. And I cannot wait to see you at the conference. What you've just talked about stuff that is so relevant and so mind-blowing, and it's just great to know that there are researchers and there are projects out there who are looking at this, when I know so many families and parents and professionals are thinking, what do we do, what's happening here? We know that there might very well be some end to this at some point. So thank you, Louisa.
My pleasure. Thank you so much.
You too.